morning, everybody. Thanks for joining me today. COVID-19's impacted on all of us, and some more than others, and I again offer my sincere condolences to Manitobans who have lost a loved one to COVID. My thoughts and my prayers go out to those who are currently battling this virus as well, and many are. COVID-19's handed us new challenges even more than before. It's challenged each of us to show who we really are. And most Manitobans are showing their resilience, they're showing their innovative skills, their adaptability, and they're showing their determination too, and I say thanks to them and congratulations to them for that. Our number one priority has been in this pandemic to make sure that we're doing our very, very best to protect our most vulnerable citizens and ensure that the healthcare system they need is there for them. We've strengthened it in many ways, and I'll share with you early next week a number of the additional advantages that we're creating to make sure that that happens for Manitobans. Notre priorité numéro 1 dans cette pandémie est de protéger nos Manitobans les plus vulnérables, de veiller à ce que notre système de santé soit là pour tous les Manitobans qu'on dit en besoin. We're taking further steps to protect Manitobans, and today I want to talk to you about our rapid testing program. The rapid testing program is going to focus on protecting our frontline workers and those they care for, including those in remote communities, our hospitals, personal care homes, our schools, and in our corrections facilities as well. Rapid testing is critical. You know, we've upgraded our testing, our regular testing, tremendously. It's quadruple what it was just a few weeks ago. So people who need testing now can get it, and they can get it quickly. That's really, really important in fighting COVID. So you can get your result quicker. It also is important in letting you get back to work and in making sure that we do a better job of helping you protect your friends and those around you. Rapid testing is a real important part of that because it helps you get your result back faster, and that helps you to get back to the front line if that's where you work. At the beginning of November, we received 13 of the what are called Abbott ID Now rapid test devices, along with enough supplies to do about 4,000 tests. And these are non-point of care diagnostic tests. What that means, of course, is you have to go out and get the test done and then wait for a result back from it. And they've been deployed across Manitoba as an additional tool in our fight against COVID-19. But I want to talk about something else. Just yesterday, Kelvin Gertson, our education minister, announced that students from grades 7 to 12 are going to be going to remote learning for the first 2 weeks of classes starting January 4th of next year. And as well, families and caregivers with students in kindergarten through grade 6 would have the option of using remote learning. There are a number of reasons for this, and Minister Gertson explained those yesterday, but I think you get that there's an important benefit here in protecting the safety of our children by allowing that little buffer into the new year for a better chance to protect those who may be exposed to risk over the holiday season upcoming and in the colder temperatures that are coming of getting COVID. So what this system will do is help ensure that a return to in-class learning following the winter break is as safe as it can possibly be for our children and for all those who work in our schools. We want to ensure our children are protected, they're safe, they're healthy when our schools welcome those young people back into their classrooms in the new year. And that's why I'm announcing today that our government will be prioritizing teachers in the next wave of dedicated rapid COVID-19 testing. I'm also announcing today that our government has placed a new $40 million order for the Songbird High-Risk tests. These tests are more appropriate for point-of-care diagnostics. And just to give you a quick background on this, this device was only approved by Health Canada at the very end of September, and we've tested the test device over the last number of weeks to ensure its effectiveness and its utilitarian value and its reliability. And we are confident that this device is going to help us tremendously. These machines will help us deliver 45,000 tests a month for the next year. That gives us the capacity to test every teacher, every educational support staff, twice a month, right to the end of the school year if needed. We are, I guess, to put it this way, we are hoping for the best, as you are too, but we're preparing for less than that. Our goal is to ensure that our frontline workers and all those who come into contact with them are protected and they're safe, and also to ensure that they can safely stay on the job knowing that they don't have COVID. This will protect the services that Manitobans rely on, and of course we all rely on our education system to protect our children and prepare them for the future. This latest development in our rapid testing plan is going to help ensure that our province is well positioned to respond to the challenges this virus is presenting now, but also the challenges it may present in the future. And I should point out that leading health think tanks are projecting additional case numbers coming towards the end of the year. US-based think tank predicted triple for Canada. Dr. Tam has referenced double the number of cases. We cannot stop in our efforts to do the right things to protect our population here in Manitoba, and we will not stop. Speaking of protecting, I want to talk about another topic that's, I think, increasingly top of mind for all Manitobans, and that's a COVID-19 vaccine. You just heard yesterday, I think it was reported yesterday, that Great Britain has just authorized and is going to be dispersing a vaccine already, so it's coming. And I will use this opportunity to remind Manitobans that that's the cavalry, but it isn't over the hill yet, and let's make sure that we do the right things and stay doing the right things now while we're waiting for the federal government to acquire the vaccine for us and to distribute it. This is an emotional issue. It is literally a matter of life and death. And while there's hope that comes with a vaccine, I have to remind everyone again that that vaccine is not here yet. So in the meantime, follow the fundamentals. Limit your close contacts, as you've been doing. Don't gather with people outside your household. Only leave your home for essential purposes. Our government has been asking for clarity for some time from the federal government regarding the availability and distribution of the vaccine. We're sympathetic. We understand. They've tried to order it, and there are lots of questions to be answered. But we believe it's important to develop a coordinated plan, a nationally coordinated plan, with all the provinces having input. We've said this for some time. A national approach is the right approach. So we don't have different approaches in Kenora from Steinbach, or on one side of the street in Lloydminster that's in Alberta from the other side of the street that's in Saskatchewan. This is not the way to do this. And so I say that because I believe that clearly established protocols and timelines for procurement and distribution are critically important. Today, I want to assure Manitobans our planning is going ahead full speed in spite of the lack of information that's been coming from Ottawa. For the most part, we haven't got answers yet to the questions we need answered, but we are preparing in any case. Our team's been planning and preparing, in fact, for months for a vaccination campaign that will be unlike anything else this province has ever seen. In early days, Manitoba's strategy is going to be to focus on bringing people to vaccination sites to maximize capacity, because early vaccines have significant logistic and handling requirements, such as the need for them to be stored at minus 80 degrees Celsius. And we all know that our winters are challenging. They're just not that challenging, so we can't just store them outside. We need freezers. And the first freezer able to store safely one of the COVID-19 vaccines at extremely low temperatures has already been delivered and installed. We're getting ready. We have enough medical supplies, including needles and syringes, to deliver 2 doses, which is what is necessary with the early vaccines, approximately 30 days apart is what we're told, to every Manitoban. We are getting ready. In early days, Manitoba's strategy is going to be to focus on bringing people to vaccination sites to maximize our capacity. In other words, to get as many of you vaccinated as quickly as we can. We're taking steps also to create an additional workforce for this surge in the demand for this service. This vaccination workforce is critical so we can distribute the vaccine quickly, safely, through normal vaccine channels. We're working to create a specialized course to administer vaccines. So these and many other steps have been taken and are being taken right now. And I know you're anxious to learn more, and we will share with you at every opportunity more announcements about some additional job opportunities, your chance, if you'd like to contribute to our fight against this pandemic. We'd love to see, for example, retired nurses come back, help if they're able. We've been really impressed by the willingness of nurses and other folks who have skills and have come back to participate and join in our civil service to participate in protecting others against this vaccine. My message to you today, I guess, is this. We're ready to receive that vaccine as soon as it comes. I want to address another point that I think must be addressed, and it's a difficult one, but I think it's important to be frank. For several weeks, as you know, I've been advocating for a nationally coordinated distribution plan for a COVID vaccine when it arrives. And that includes a national strategy for distributing vaccines to Indigenous peoples and First Nations across Canada. As you know, we have the largest percentage of population of any province of Indigenous people. And unfortunately, the rate of infection among Indigenous Manitobans is higher than it is among non-Indigenous people. So we believe it's of critical importance to get that vaccine to our northern communities, to Indigenous people there to protect them. But a national strategy is not the path the federal government is on, and the health and welfare of Indigenous Canadians is the principal responsibility of the federal government, and yet they're not acting that way. And so I have to raise this. I've raised it repeatedly with our Prime Minister. We've raised it on our calls. Getting a vaccine early, getting a vaccine safely is a matter of life and death. And Manitobans and Canadians deserve to know the details as soon as possible. A well-communicated and well-designed national plan is critically important for those Canadians who are increasingly stressed, and I'd say that's most of us. If done properly, it can provide hope during this winter, and this winter will be one of waiting for many, many Canadians, waiting for a vaccine to come. Thus far, the federal government's provided us with very little concrete information, but what information we have gleaned gives us much to be concerned about. The federal government's allocation approach is going to hurt Manitoba, and it's going to put Manitobans at a disadvantaged position. The federal government is telling us that they are going to distribute the vaccine on a per capita basis based on the population. That sounds good if you don't think beyond that simplicity. They are also telling us that they are going to hold back the portion of our vaccines for Manitoba that they would then allocate to Indigenous and First Nations communities. What that would mean then is that Manitobans who do not live in northern Indigenous communities would be the least likely to get a vaccine in the country. There would be the least amount available in Manitoba after the federal government holds back the portion for Indigenous people of any province in Canada. This puts Manitobans at the back of the line. This hurts Manitobans, to put it mildly. We would have the least amount of vaccine available, in other words, for everyone else in our province. And this is unfair. And this is not what our Indigenous leaders want, and I'll be meeting with them again next week to discuss this important issue, and I welcome their input. But I do not believe this approach is helpful, and I do not believe it's healthy. Manitoba has the highest proportion of Indigenous peoples of any province, and we're proud of our Indigenous and non-Indigenous populations working together as people who share neighborhoods, who share goals for one another. But we need the federal government to recognize our unique needs here by providing an additional allocation of vaccines for Manitobans to use in First Nations communities first, and to do this across the country, because this is their constitutional responsibility. It is their responsibility. And First Nations leaders, I know, share this perspective, that they have not lived up as a federal government, not just this one, but for generations, to the obligations to protect Indigenous people is clear in our history. Now they have to step up and protect our Indigenous communities first. And they need to do this, but not punish everyone else who lives in the same jurisdictions as Indigenous folks by shortchanging them on their share of vaccines. I want to be clear on this. We want all our citizens to have a fair chance to get the vaccine as early as they possibly can. We all agree that our most vulnerable populations, our frontline workers and the people they care for, should be at the front of the line. But what happens after that depends on a national strategy and a national plan, and the one we've heard about so far puts Manitoba at the back of the line, and that is not acceptable. These aren't easy issues to raise, but we've been raising them for weeks without satisfactory responses from Ottawa, and so I'm forced to raise them now, because a vaccine is coming, and when it comes, Manitobans shouldn't be the ones waiting the longest of any Canadians to get it. These past few weeks have not been easy. The next few weeks won't be easy either. And let's be frank about that. But I'm confident if we continue what we've been doing, of working together, we can get back to beating COVID again. There's reason for optimism. As Dr. Roussin has said, our average number of contacts of those who get COVID is coming down, and that's an important reality that shows that we're working together to reduce the ability of COVID to snowball and to grow and to afflict others. The best thing we can do for all of us is bend that COVID curve down, and that takes all of us on the team. We all have a role to play to protect ourselves, to protect our loved ones, to protect our community, and I believe that Manitobans can do that because I've seen Manitobans do that. We did it once. We need to do it again now. We need everybody on Team Manitoba. I'm asking Manitobans to do that. When we were abiding by the fundamentals, we were beating COVID. And perhaps it's partly because we were so good at it, we lost our way and started perhaps to take COVID for granted. But COVID's a sneaky adversary. And it wins when we don't listen to the fundamentals, like stay home. Only leave home for essential purposes. Limit your contacts if you have to leave home. Limit your contacts. Stay home when you're ill. Stay home when any member of your family is ill. Don't socialize with people outside of your household. As hard as that is for Canada's friendliest province to do, it's what we have to do. Wash your hands, cover your cough, practice physical distancing, wear a mask, and be kind to somebody. Smile with your eyes. They can't see your mouth anymore, but smile with your eyes and let them know that you're with them. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CHVN, Taylor.
Hi, good morning. My first question is, when the vaccines do come, will they be mandatory for Manitobans to get?
No. But we will do everything we can to appeal to Manitobans to the common sense of getting a vaccine and protecting yourself and others from COVID.
Great, thanks. And do you have an idea of when this vaccine will be coming?
There are a variety of them in various processes or stages of approval, Taylor, and so again, what we're asking the federal government to do is communicate to us their plan for prioritization first and foremost. We think the sooner that we can let Manitobans know and Canadians know what the order is, the better, so that people don't have to worry as much. They can understand. And I think all of us can understand that frontline workers and our folks in our personal care homes need to get the vaccine early because they are in a dangerous position. But beyond that, we need to get to the details of the priority list so that people can understand who's getting it and on what basis as soon as possible. And so we're appealing to the federal government to do that now.
From the Winnipeg Free Press, Larry.
Premier, on a different topic, do you think that the province's anti-harassment legislation was meant to protect those in the top echelons in government from questioning or criticism? And if so, would you yourself ever consider filing a harassment complaint against an MLA?
When the opposition resorts to unprecedented efforts to attack civil servants personally with false, poorly researched accusations, I think that's exactly what the anti-harassment, anti-bullying legislation was designed to prevent. That is the kind of conduct that some people want to make excuses for now, but they should not. It's unprecedented. What's unprecedented, some say, a columnist in your paper today said that it was unprecedented that a civil servant would file a complaint. It's unprecedented that a civil servant would be attacked like this, personally attacked on the basis of false information. And so I can only say I'm going to stand up for our civil servants at every level. They've been harassed in the past by previous misbehavior, by people that should have known better, and the present opposition should know better than to do it now. They should be ashamed of themselves.
Your government has attempted in the past to better protect whistleblowers. Mr. Sala alleges that folks investigating the complaint made by the senior civil servant demanded that he reveal the names of his sources. Doesn't that go against at least the spirit of the province's whistleblower legislation?
The individual in question has made false accusations in the House and outside of it against a civil servant that he cannot prove because they are false. So the legislation is not designed to protect people against making false accusations that are damaging to the reputation of a human being who is put in a position, unfortunately, of having to defend themselves in the civil service. If Mr. Sala or anyone else in the NDP wants to attack me, they can have at her, but when they're attacking a civil servant in my province, I'm going to stand up and defend the civil servant every single time.
From Global, Marnie.
Good morning, Mr. Premier. Just on the rapid testing, prioritizing teachers, if that potentially means we have more positive cases and more teachers are forced to self-isolate, putting them out of the loop, do we have a plan in place to address that, to an increased number of teachers having to self-isolate?
Well, it's exactly what the self-testing initiative or the rapid testing initiative is designed to address. We've been fortunate in not having, as Dr. Rousens pointed out, as much transmission in our schools and not having had the outbreaks that a number of other jurisdictions in Canada have had, and that's good, but we should never take that for granted. What the rapid testing will do is offer that additional protection to teachers and those they teach, also to those, I should mention, who work in the schools, custodial staff and teachers' aides and folks like that, so that they're able to know if they've got COVID within a day, not have to wait for 4 or 5 days. That's really important because we want to make sure that teachers have the chance to teach. We want to make sure that they can do it safely, and we want to make sure they have access. So access to the testing so they can be confident when they're offering instruction to their students. And I'll tell you, as the son of a teacher, brother of a teacher, former teacher for a few years, I can tell you that relationship that teachers build with their kids is so critical and it's so precious, and you just don't want to jeopardize that when you have to leave the classroom setting for several days because you've got the sniffles. So, you know, I'm excited about this. I think James Bedford and the MTS will be pleased. I hope they are. It's my favorite union. And I do want to make sure that families know that we're doing everything we can to get the folks who are working with their children the testing they need so they can be safe and confident and be back at work quickly, so we don't have to bring in, you know, folks, nothing against substitute teachers. My mom did a lot of that, but that's the second option. The first option is to make sure we can keep our teachers working with the kids that they love and want to work with.
Thank you for that. And with the remote learning plan announced yesterday, it's received a bit of criticism from the Manitoba Teacher Society, saying it's going to be swamping educators who are already stressed out. What's your response to teachers feeling an added pressure with an added workload?
Okay, well, a lot of the divisions have assured us they have plans for remote learning. They've allocated folks to assist with remote learning. And I would say two things, I guess, to the teachers. I really appreciate and thank you for what you're doing. I've seen so much, I've heard so many reports of great adaptation, rising to the challenge of these stresses that teachers feel, of not communicating that to the kids too much. Those are tough things to do, but that's what our teachers are doing, I think, and that's wonderful. I'd say this, I think that teachers need to understand that what we're doing here, the flexibility we're providing, it comes from the heart. It's a desire to make sure that we're doing the best we can to protect our kids. And I know teachers want that to happen, and I know and I respect that there's additional work here. I do. But I think that work's worth it. and I think it's worth it because it's going to protect our kids better. And with the rapid testing that we're going to be able to roll out, initially in Winnipeg, and then there'll be more detail to reveal on this, but we're working already on regional availability, so folks in teaching in Boissevain don't have to come to Winnipeg to get tested. That's important to know, but that they're able to be tested closer to home regionally so they can get back safely to their home community and hopefully back to school without knowing that they don't have COVID. That's great news, I think, for our teachers, and I hope they're pleased. I'm excited. I think this will really help not only teachers, obviously, as I said before, but help parents to know that their kids are going to be taught by real teachers in an environment where they're safe and they know they're safe.
From the Brandon Sun, Colin.
Hi, Mr. Premier. When you were making your announcement, we had a reader who works at a daycare reach out to ask if daycares would be included in the rapid testing program given their important role in taking care of the kids of essential workers.
Yeah, it's a fair question, and it's on the radar for sure, as are, I should mention, other facilities. And I would mention also, and I'm not equating the two here, but prisons as well, that there are frontline workers there who would also really benefit. We've ordered many machines, and now we're developing the rollout strategy initially with education as our first challenge, and of course our personal care homes are high priority as well, and then moving to other facilities as well. There'll be more to say on that as we roll out the full detail of the plan in the coming days. But I'd also want to say a thanks to our daycare workers. My niece works manages a daycare, and it's pretty important work, and it's pretty stressful right now for the daycare workers too. So thanks to them.
My second question is, I know previously you've complained that the federal government has interfered with ordering things like rapid tests. Did you encounter any problems when making this new $40 million order?
No, I didn't. I don't think it's fair to say I complained. I do think, though, that the restrictions they put on our ability to look into ordering additional vaccines was the issue I spoke to. But the federal government limited our ability to order with essentially a stop order mechanism that prohibited subnational governments from ordering vaccine. However, we are able to order, as I've announced today, the rapid testing devices, and we have taken steps to do that. And I should mention, these are proven to work. Their reliability, the plus minus on their error rate, whatever the technical term is very low. In other words, their accuracy is something that, though never guaranteed with these testing devices, is very, very high. And we've test-driven the devices to make sure that that's the case. So they were only approved short weeks ago, and we're able to roll them out now with that assurance to Manitobans. I'm pretty excited about that.
From CJOB, Clay.
Good morning, Mr. Premier. First question is, what is your take on this Winnipeg church that's taking the province to court this morning, saying it should be allowed to have drive-in services in their parking lot, and saying the current public health orders are violating their charter of freedom?
Yeah, well, we'll abide by the court's decisions, of course, Clay, but I would say, as I've said before, that we're very appreciative of the work of our faith communities all over the province, and I want to say thanks to them. I know they've had some challenging times here too, as we all have, and for the in the vast majority, apart from some anti-mask foolishness, we have had faith communities that have worked very, very hard with us to protect their congregations, parishioners, whatever the correct word is. So I thank them for that. On the issue of the parking lots, we've endeavored, Dr. Russin's endeavored to explain. We allowed this in the spring. We didn't allow it with the recent orders. It's one of those very difficult calls. We're going to be meeting with faith community leadership early next week to get their ideas, not specifically on parking lot services, but on many other issues. And I really value the work of our faith community, and so I want to be sure they understand. These are tough decisions we're making. I think most of our religious leaders do understand and accept that. And the intrusion into their rights is something that I don't do with joy. The assertion that we're violating their rights is a tough one for us to I suppose, respond to unemotionally, but I'll just say this. I think that, frankly, I hope they understand that what we're trying to do here is save lives. And I sincerely ask them for their help and support and their understanding as we make these decisions with an unprecedented challenge in front of us.
Just a quick follow-up, Mr. Premier. You were speaking a little bit earlier there about Indigenous communities. Will the provincial government ask the federal government for any assistance in dealing with some outbreaks that are occurring on First Nations up in the north, particularly Shamattawa, for example?
Yeah, no, we're working together with the First Nations and federal government on this. And again, I wouldn't want to be taken as too harsh a criticism of our First Nations leadership at all. I've congratulated publicly, and I will continue to congratulate privately our First Nations leadership in Manitoba. Regardless of the fact that there have been outbreaks in recent weeks, that shouldn't be taken as a criticism of our First Nations leadership. They've been stepping up, and they've been doing their absolute best from the time this pandemic started. Early days, I remember I visited Long Plain. It's near where I grew up, and I visited Long Plain early and noticed that they were making sure that they had patrols to safeguard their neighborhoods in the community on the reserve, even when Manitoba had a very, very low positivity rate. Those steps were being taken on Long Plain. They were being taken on most of our communities, Indigenous communities all over the province. That's a tribute to our First Nations leadership. So now, as cases have made their way into our First Nations communities, the First Nations leaders are being subjected to some criticism by some. I think that's unjustified, quite frankly. I've seen their efforts. I think they're sincere. And regardless, COVID's an awful hard thing to fight. But I think our First Nations leaders are doing their best. I want to work with them. That's why I've communicated already to Arlen Dumas and others that I want to speak with them about how we make sure that we have a plan that we can work together on as Manitobans that gets the vaccine to First Nations communities, but also gets it to all Manitobans as quickly as we possibly can.
From the Winnipeg Sun, Josh.
Good morning, Premier. You talk about the rapid testing for schools, and it's going to be available for teachers and staff. Are there any plans for strategic testing or rapid testing of students, especially considering there are concerns if we are sending, especially the 7 to 12 students, giving them that 2-week break? Is there any plans to test them before they come back to school from the remote learning? Is there any kind of testing plan that way?
No, Josh, that wouldn't be appropriate. These testing devices aren't designed to be used with children, and there hasn't been the numbers that would make the children in our schools the priority for rapid testing. The rules would apply as they have. If you're ill, you stay home for kids. For teachers, if you're ill, you got to get tested. And we want the rapid testing so that teachers can get that and have the knowledge of whether they do or don't have COVID as quickly as possible so they can get back and teach those kids. So that's the focus, Josh, of the testing for rapid testing.
You mentioned, or you said multiple times how you want a plan put together for vaccine distribution by the Ottawa. Yesterday, Alberta released their plan for vaccine distribution. Does Manitoba have plans to put out to the public if Ottawa fails to put together a cohesive plan for every province? Is there plan, or is Manitoba going to put forward their own plan for proper distribution of vaccines?
Great question, Josh. Absolutely. Our first hope would be the feds would step up and make clear what their plan is, in particular for Indigenous Canadians, because that obviously has ramifications for what our plans would be, right? For example, if the feds want us to do it, we need to know because that affects our plan, and our resources have to be pulled together to do that. And if they're going to do it, then clearly we can focus our resources differently, So yes, absolutely. I'll raise it again with the Prime Minister. I have conversations with him now on a regular basis, and I've raised it several times. I need to raise it again. Because we need to get clarity from the feds on what their plans are. But in the absence of any clarity, that's not been forthcoming to a sufficient degree thus far, We're going to put out our plan the next couple of weeks so Manitobans can see it, and as we often do, get their perspectives on how they feel the plan would work for them, and then finalize as we move forward.
From CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada. Premier, is the idea that these rapid tests are to replace, to a certain extent, conventional testing? Would these be used usually when, say, a teacher is symptomatic, or is it also, or otherwise, some sort of sentinel testing?
We see initially that these would be available when symptoms occur. To offer asymptomatic testing on a broad basis would then create longer lines for those who have symptoms. At this point, our positivity rate is so high, Gavin, that we don't want to create longer lines for those who have symptoms. We need to have people tested quickly who have them, not put other people in the line to get testing who don't. The opposition's advocated for asymptomatic testing. It may have some place in some environments, but we think initially that the best use of our rapid testing and all our testing is for those who have symptoms, demonstrated symptoms. So as quickly as possible, they'll know whether they do or do not have COVID and can either recover or get back to work.
Can you just explain briefly why the new machines are better than the old machines?
I can explain that they are for on-site testing results, so they're somewhat different in their intent, and I'm not a technical guy on the machines, but I know enough to know. The Abbott testing devices are designed for group testing situations. The Songbirds are designed for individual testing situations. Reliability numbers are different, but they're different in their use. So they're two different tools, both have uses. We think for the Songbirds, the use is very appropriate to helping our frontline workers, including our teachers, getting back to work as quickly and safely as possible.
From CBC Manitoba, Bart.
Hey, Mr. Premier, maybe I'm not that bright, but can you explain how Ottawa's plan endangers Manitobans, as you said at the top?
Well, I'd like to respond, but first of all, you are bright, Bartley, so we should make that very, very clear. And you should understand that, of course, because we have the highest Indigenous population in Canada, if the federal government dips into our supply of per capita vaccinations, that leaves less left than any other province to distribute to our other people. So we need to know what the plan is, and we need to know as quickly as possible, because the allocations that we make are based on an understanding of what the federal government's going to leave us with at the end of the day to distribute here in Manitoba.
Okay, thanks for that, Mr. Premier. Big picture question. We're 8.5 months in. You've seen the criticisms, you've seen the praise for certain aspects of the things your government has done. How would you respond at this point, at this very moment, to how well you and your government have protected Manitoba?
I would say that the criticisms have outweighed the praise, and I would say to Manitobans, I totally understand that. I totally understand that. We had virtually no cases for, as you know, Bartley, for significant months. We were among the lowest in Canada, apart from perhaps a couple of the Atlantic provinces on number of cases. We didn't have any experience with COVID as people. And the government is responsible for preparing, and we prepared in spite of that. I said to you frequently and to others in the media, and I meant it, we are hoping for the best but preparing for the worst. You remember me saying it's a tired adage, but it's the truth. We were preparing, and so what you're seeing now in Manitoba is a result of all that. We are, in terms of initial influx of cases, predominantly in October, and then again in November, which was the worst month any of us have ever experienced probably in our lifetimes. Our capacity for things like testing was quadrupled. You can't do that in a matter of 3 weeks. You did that as a result, we were able to do that as a result of the planning, the preparatory work that we did all summer. But it doesn't stop the fact that people had to wait too long, and that people had to wait for the first time to get a COVID test. So I guess I just say I understand, that the complaints are going to always outnumber the praise. I didn't get into politics. Unlike some, I didn't get into politics for the adulation. I got into it to do a job, and we're doing that job to the very best of our ability. But the praise goes to Manitobans. As you're seeing now, we're really the only jurisdiction that's holding the line somewhat on COVID cases, despite the reality that most health experts have described of the likelihood of increased cases. We're not seeing that week over week now. We need to continue in this direction, and we need to improve on it, as Dr. Roussin said. We're not there yet. This isn't a victory lap. I'm not suggesting we're taking our foot off the gas on preparing for COVID. But there's your long answer. I know it's a matter of life and death. I feel it personally and deeply. I think I want Manitobans to know we're doing our absolute best. Our team in government is doing its best to prepare us and asking people to work with us and cooperate. We tried for months to convince people to do things that most Manitobans are now doing. And now we've had to step up enforcement. That doesn't give me any joy. The reality of giving out a ticket is that it's hard, but you have to do it if people won't listen any other way. We're doing that. We're responding, but we're also proactive. And so today's announcement's about being proactive, and we'll continue to be planning for the future in the best way we possibly can. Again, hoping for the best, preparing for something less than that.
From CTV Winnipeg, Jeff.
Oh, hi, Mr. Premier. Just looking at the news release here, talking about large-scale super site vaccine campaigns. So I just wanted to know what the province's vision is for that. Are we talking about, arenas, large community centers, and are we talking about, people lining up there or appointment-based? Like, I'm talking about once we get past the initial, doses given out to the the people most at risk. Like when we're talking about more the general population. What's the vision there, and how similar is it to the flu campaign?
Yeah, that's what I was alluding to earlier, Jeff. I want to share with you, but in the coming days, excuse me. Much of what you said alludes to what we have at the planning stage now. We're well along in our planning. But again, my hope would be we can coordinate it with the federal intentions in particular, but not solely on the Indigenous piece. We have to be sure that we're coordinated well. We have to make sure that we don't create situations where people are moving around the province too much, because movement can take COVID with it. We want to make sure that the availability is uniformly advanced so that we don't discourage people who may not think they're going to get a vaccine when they may be getting it. And the reverse is also true. We don't want to give people false hope that they're getting a vaccine soon when in fact they may be waiting some months to get it. So the coordination with the federal government is essential. In the absence of all the information that we would like to get from the feds, we are advancing in our planning. I'll be sharing that with you in the coming days.
Okay, thank you. My second question, and I know it was asked kind of off the top here, but I know you're waiting on more details, you say, from Ottawa. But probably one of the big questions that people are asking is, when do you anticipate the first doses to arrive in Manitoba? You say you've got one freezer ready to go that I think it says can hold I believe 1 million doses. When do you anticipate the first doses to arrive in Manitoba?
Okay, we've got two questions there, and one is prefaced on a false assumption. We're not waiting for Ottawa at all. We're asking for Ottawa's help in giving us additional information while we're preparing. We're preparing in the absence of some important information we'd like to get from Ottawa. We're preparing every day. So we'll have a full plan to roll out, and Manitobans can have a look at it. But on the second one, in terms of the numbers of vaccines, that's part of the clarity we need. We need to know, because the federal government hasn't allowed us to buy vaccines. They're buying them. We need to know when we're getting them, and we need to know what percentage we're not going to be able to distribute, because they're going to be going to First Nations communities. And we support First Nations communities. We want First Nations communities to get the vaccine, but we need to understand that percentage, and what is it going to be? We need to know that, because it fits with our storage requirements and our transport requirements, our availability, and so on. So an integrated strategy is what we need. That's what we're pushing. Manitoba's been leading the way in pushing for this, and we'll continue to push for it. In the absence of that, I'm excited about the work that we're doing, and that we'll be able to share with Manitobans in coming days.
From City News, Jonas.
Good afternoon, Mr. Premier, or good morning, I guess. Just going to follow up on the vaccine and your comments on Indigenous communities. SCO came out this week and said that these comments aren't really helping matters. The word they used was fear-mongering. I would just wonder your comments on this.
Well, all I can say to you, Jonas, is if talking honestly and openly about how we get a vaccine out to people is fear-mongering, then I guess I'm guilty of fear-mongering. I don't think that that's the case. What's fearful for Manitobans is not knowing when they're getting the vaccine. What's fearful for Manitobans is not understanding how the rollout's going to occur. We're trying to do our best to get that clear. We need the federal government's help, and we need their information to make sure that we have the best possible plan. Every province needs this. And so I don't agree. I don't agree with the observation. I'm trying to address fear and replace it with some certainty and understanding of when we get the vaccine. I think that's what Manitobans want me to do. And that's my job. And I'll keep doing my job.
Fair, sir. As a follow-up, have you been given any concrete direction that, the per capita doses for Manitoba will be taken away? Or is this just a concern at this point? I guess I'm just trying to follow up on, this issue itself is pretty controversial. Just wondering if there's any indication you have that this might be happening.
There's every indication we've been given that this is exactly what's going to happen.
Our final reporter this morning from Reuters news agency, Rod.
Yeah, hi, Premier. Can you elaborate on that regional site approach to vaccinating northern and remote communities? For instance, how much of the northern population are you planning to move to other communities for vaccination? How many sites do you plan to use to deploy vaccine?
Rod, you've just nailed exactly the centerpiece of the challenge that we face. We have the largest Indigenous population of any Canadian province, and we can't get clarity from Ottawa on what their game plan is for our northern communities on exactly the issues you just raised. Until we can get that clarity, it's very difficult for us to be part of assisting. We'd like to assist, and to be part of developing our own plans for the other parts of the province. And let's understand something here. And I want to put this to bed right now, because I can understand that anytime I use the word Indigenous, then someone thinks that that's a racist comment. It's not anything but a concern that our Indigenous population and our non-Indigenous population are treated fairly, and that they get access to a vaccine in an intelligent, strategic way as quickly as possible. Half our Indigenous population in Manitoba approximately doesn't live in northern reserves. They live in our communities of our province, in our regions. They live as neighbors and friends with non-Indigenous people. What's the plan? What is the federal government going to do? Is it leaving out Indigenous people who don't live on reserve in its planning? If it's doing that, it's making a big mistake, because that's going to disadvantage Indigenous people who live in Winnipeg, Selkirk, Porters-la-Prairie, Brandon, many communities of our province. I want to see the plan from the federal government. We're going to devise our own plan, share it with Manitobans. I'd like to do that in the presence of an understanding of what it is that the federal government's going to be doing for Indigenous people, besides telling everybody that they're a vulnerable and important people. We all know that. But knowing that doesn't give us a plan. That's just not helping. We need to understand what they're doing so we can work with them cooperatively, strategically, to get this vaccine to Indigenous Manitobans, Métis Manitobans, non-Indigenous Manitobans as effectively as possible, as soon as possible. That's what I'm after.
You've also said that you're well on the way with your own plan, though. Can you give us a more detailed idea of visiting for the north and remote communities? Presumably from vaccine arriving at Winnipeg Airport to ultimately getting to those regional sites up north. What does that look like?
I've already committed to rolling that out in the coming days, Rod, so I'm not going to steal my own thunder on that. But let's suffice to say that it's clear with your two questions that you understand very well that the interrelationship with the federal plan is essential to understand before you develop your own. And that's what we're asking. We're asking the federal government to give us greater understanding of their plan so that we can integrate our strategies and work together. That's really, really critical going forward. I just want to finish with something. Reporter asked me at the last scrum why I like to be hated so much. That was, I believe, the question. Look, if you don't care for me, I understand. I totally do. I'm the guy who has told you that you cannot shop. I am the person who has come forward here in front of you 75 times and has asked you to do things you've never done before and has asked you to do that every day. I am the person who has told you you can't go to work. I am the Premier who has said you can't run your business because we have the toughest restrictions in Canada and it affects people who put their lives into their businesses. I am the person who has come before you and said, you can't go to church. You can't see your friends. You can't travel. I'm that guy. And I totally get that you don't like that. I don't like saying it. But it's got to be said. Someone has to say it. And so I'm the one that took on this job to say it. When I was 14 years old, I lived with my grandparents and I was late for school one day. And the principal was an ex-military guy named Bill Taylor. And he met me at the door and he looked up at me because I was a pretty gangly kid. And he said something I'll always remember. He gave me heck, and then he looked at me, and I guess I frowned or scowled or something, 14-year-old boys do, and he said, you don't like me right now, son, and that's okay. I want you to respect me in 10 years. That was good. It stayed with me, and I do respect him. I respect him for what he did. He did the right thing. It wasn't the easy thing. So, I'll say this to you. Know this about me. I did not get into politics for the adulation. I got into politics to do the right thing, try to save my town, try to help people. I do what I believe is right. I do what I believe is necessary. This is who you need right now. I am that person. I will do what I believe is right. And right now we need to save lives. If you don't think that COVID's real, right now you're an idiot. You need to understand that we're all in this together. You cannot fail to understand this. Stay apart. So I'm the guy who has to tell you to stay apart at Christmas and in the holiday season you celebrate with your faith or without your faith, that you celebrate normally with friends and with family, that where you share memories and build memories. I'm that guy. And I'll say that because it will keep you safe. I'm the guy who's stealing Christmas to keep you safe because you need to do this now. You need to do the right thing because next year we'll have lots to celebrate, and we'll celebrate this year if we do the right thing this year. You don't need to like me. I hope in years to come you might respect me for having the guts to tell you the right thing. And here's the right thing. Stay safe, protect each other, love each other, care for each other. You got so many ways to show that, but don't get together this Christmas. Thank you.